Okay, so today we will be discussing ethics, the part one of ethics. I believe few of you all must have attended the ethics 2 class. Few of you all who have joined later would may have missed, but don't worry, we are going to be covering what we did last month as well. Now, medical ethics is very important topic. You can get questions on medical ethics in any section. A question on emergency can also be related to medical ethics. A question on OBGY, infections, pediatric age group, anything can be related to, can come as a medical ethics question. Again, we follow the same golden rule to read the question correctly, to understand the stem of the question, what they are actually asking us. So there has to be in ethics legal reasoning and logical thinking. So basically you have to apply a logical thought process to get the correct answer. I'm sure you guys must have solved few questions so far in ethics. You all must have gone through certain questions or doubts, but we'll be discussing today the basic. Today's class is the base class, which will give you a lot of clue on how the patients can present and how we have to approach. So let's begin. Both of you all, Dr. Tejal and Dr. Romina, either unmute and answer, or you can drop your answer in the chat box, however you all are comfortable.
Okay, ma'am.
The surgeon has forgotten a gauze in the abdomen of a post-op.
Sorry, but we can't see your screen, ma'am. It's still blank.
You all can't see my screen? Okay. Now visible?
Yes, now visible.
Okay. So the surgeon has forgotten the gauze in the abdomen of a post-operative patient. What should the surgeon do? A. Don't tell the patient. B. Tell the patient, apologize and get it out. C. You tell the hospital committee. As per you, what do you think should be the correct step over here?
It's B, ma'am. Tell the patient, apologize, and get it out.
Okay. Dr. Tejal, what do you think? Why are we looking at this option? Why not tell the patient, or why tell the hospital committee is wrong? What is your logical thinking and reasoning behind it?
The patient needs to know, ma'am.
Okay, the patient needs to know.
Yes. If there is anything wrong with the patient has the right to know about it, ma'am.
So, when we talk about these questions, first of all, we have to do no harm to the patient. Most important thing is ethical and legal reasoning, very high yield points. So, as the duty, you have to disclose all medical errors to the patient, no matter, even if it's a small error. Autonomy and informed consent. The patient has the right to know what has happened. You have to practice non-maleficence and beneficence. That means you do no harm. You have to correct and minimize the harm if it was done. And you have to also maintain your professional integrity at that point of time. If you're going to be honest and you're going to disclose honestly, that will not only help in minimizing the risk, but it will also reduce the litigation if you follow it properly. Not telling the patient is illegal and it is unethical. And telling the hospital committee it's an incomplete option. Of course, you will be telling the committee, but that is not going to change your decision of not telling the patient. You cannot just say that you are not going to tell the patient and you are just going to inform the hospital committee. So, the correct sequence that we need to keep in mind is you first inform the patient, you apologize to them, you explain to them, correct the error, document everything. Documentation is a very important part. And you inform your hospital committee or team, which is internal reporting has to be done. Have we followed?
Yes, ma'am.
Example is medical error discovered, disclose to patient, apologize, rectify. You should never, ever, never, ever conceal any sort of a medical error. Now, patient is admitted in the ICU, has asked not to be resuscitated, and has also signed a form for this. So, no resuscitation was done when he had arrested. After the patient's death, his son came complaining why his father was not resuscitated. A, tell him that you respect his father's wish. B, father had a terminal illness. C, no resuscitation is needed in brain death cases.
It's A, tell him that you respect his father's wish.
Okay. Dr. Tejal, what do you think?
It's a man
A.
telling that you respect
Why
his
are we
father's
respecting
wish.
his father's wish?
Because his father had signed the form of do not resuscitate.
Consent.
Correct. So he's given a consent of DNR. Now,
Yeah.
terminal illness has nothing to be, nothing which states that you should not resuscitate a patient. And brain
Mm.
death cases, there is no mention that this patient is having brain death. So, first of all, it is important patient autonomy. Now, this is not just important in this stem of the question. In general, also, patient's autonomy will always override the family's wishes. If the patient is competent, if the patient has given a written document, a consent, being having mental capacity, that means you have to respect their wish. A valid DNR is legal and ethical. Somebody has signed a DNR, you can't go against it and resuscitate the patient. And the patient already was in that state of mind, and he was okay. Then he mentioned that he does not want to be resuscitated, and you never require a family's consent whenever there is a valid DNR that is existing. Now, father had terminal illness, again, it will not justify the DNR, and the patient had cardiac arrest, not brain death. So that option is out of question over here. Now, again, examples, please remember patient's autonomy is most important than the family's wishes. We will always accept a valid do not resuscitate order. We will always ensure proper documentation. Family disagreement will not invalidate a DNR. So, if you know that a patient has a autonomy, if you know that the patient is competent, you have to go ahead and follow the patient's wishes. Have we understood so far?
Yes, ma'am. Yes.
A consultant has prescribed a drug for the patient, and the pharmacist is telling you that the patient has an allergy to that drug. But the doctor is insisting to give that drug. So, what are you going to do? You're going to write it and you're going to tell the doctor to sign it, or you're going to refuse gently. You are the pharmacist where the consultant is telling you to give this certain drug.
Refuse gently, ma'am.
Refuse.
Okay. Refuse gently. Now, why are we refusing gently over here? Because one thing has to be clear that no hierarchy is going to dictate you to do any harm. We practice do no harm, which is non-maleficence. That is most important. Already the patient has an allergy. You are aware about it. If you give that certain medication, the outcome will lead to serious fatal complications like death. So patient safety will override the hierarchy. It can be anyone. It can be anyone ordering you. That doesn't mean that you have to blindly follow it. So if there is any order which is unsafe, any healthcare professional has the right to refuse an unsafe order. Now, signing and giving it is again a dangerous order. In the court of law, you will be held responsible. There will be a negligence charge, and that is not, you cannot defend yourself by saying that the doctor told me to give it, so I gave. The doctor will tell you to jump in the well. Will you jump? No, right? So, you have to make sure that you have a proper defense also for yourself. Now, the example here is you can challenge unsafe orders respectfully. Matlab, show some respect and then challenge the order. You have to escalate this issue through a proper channel. Always document whatever is your concern and action. Safety is most important than seniority. So patient safety is more important than hierarchy. If any order is going to cause harm to the patient, will endanger the patient's life, you have to refuse it, even if it is given by a senior person. These examples are very important. Please try and understand them and retain them. They are not very difficult to understand. Once you've understood it, then I don't think you all will make any mistake in any ethical question.
Okay, ma'am.
A gynecologist has explained to the patient that hormonal replacement therapy will not help her menopausal symptoms at this stage. But the patient is insisting to have it. So, what should the doctor do in this scenario? Should he refuse to give the HRT? Should he give the HRT or should he refer her?
Ma'am, here it says that the HRT will not help her menopausal symptoms, but it's not going to cause any harm. So I think we can give the HRT, ma'am.
Okay, Dr. Tejal, what do you think?
So we can refer her if
You
she
want
is
to
not listening.
refer her. Okay. So, see, both of you all need to understand one thing. The gynecologist has explained to the patient that hormonal replacement therapy will not help her with the symptoms at this stage.
Okay.
But she is insisting. But you
Mm.
are the doctor, correct? So, when you
Mm.
already know that this is not going to help, will you give that medication to her?
No.
No,
No,
you will
refuse to
not
give
give.
HRT.
We have to politely refuse because what did we see earlier? We
Mm.
practice do no harm. Referring her would have made sense if there was some other complication which was associated or which was beyond the scope of your practice. If she had some other disorder along with a gynecological disorder where you wanted to refer her to a specialist. So, again, doing no harm, you have to follow it. Anything which is ineffective or potentially harmful for the patient, you will not give them. Although patient's autonomy is allowing them to choose among appropriate options, but that does not give them the right to demand an appropriate therapy. See, she is a non-medical person. She doesn't understand. She must have read somewhere, Googled somewhere, or she must have heard somewhere that no hormone therapy will help. But you are the practicing doctor. You have seen multiple cases. You know that what is the evidence-based practice. You know what are the criteria for giving it to the patient. She doesn't fit into anything. So just because she is forcing you doesn't mean that you will go ahead and give it to her. You are not ethically or legally obligated to give any sort of treatment to any patient that has no benefit. Now, giving HRT again, if you will give, then you are going to practice beneficence, correct? So why should you do that? Referring her only and only if the case is beyond your competence. That means if and only if it is beyond your expertise. So examples over here is patient autonomy is not equal to the right to demand inappropriate treatment. Doctor may politely refuse after adequate explanation. You have to always document counseling and refusal. Ethical hierarchy in exams, main important point is do no harm, most important than patient's autonomy. Patient can demand something which may not be beneficial and which can cause harm to them. They do not know it. But just because they are asking for it and you want to make money, you are going to give it to them? No, you will never do that. So, a doctor or a healthcare professional is liable to provide the treatment that is medically inappropriate, even if the patient insists. You will never provide anything that will cause any sort of harm to your patient. Clear? Are we following?
Yes,
Some
ma'am. Yes.
concepts clear?
Yes, ma'am. Clear.
Yes, ma'am.
A 19-month child has multiple anomalies. The child's mother is working as a physician in the hospital. She has told you not to intubate her child and let him die peacefully. What are you going to do? A. Respect her wish. B. Call ethical committee. C. Ignore her and intubate.
Call ethical committee.
Okay, you say you want to call ethical committee. Oh, we have Dr. Gigi also with us. Welcome, Dr. Gigi. Okay. Dr. Tejal wants to call the ethical committee, right?
Yes.
Okay.
Yeah, I'm confused with A and B. Respect her wish or call ethical committee.
But your first option was call ethical committee, right?
एक second, ma'am.
अरे इतना कंफ्यूज नहीं होने का.
Ignore her and intubate.
Okay, Dr. Rominato has thrown a sixer only. Okay.
And the point is here the child is having multiple anomalies and the mother, but the only thing is that the mother is working as a physician. So should that be taken into regard or should it not be taken into regard, and this should be in the child's best interest and we should go ahead and ignore her and
We have
intubate?
discussed this question in the ethics second class, which we had done last month, where I believe you guys, I guess Dr. Romina was there or Dr. Gigi was there. I don't remember now. But we have discussed something on this. It's okay if you don't remember. But see, this is a 19-month-old child, 1.5-year-old child. He has multiple anomalies. The mother is working as a physician and she is telling you not to intubate and let him die peacefully. There is a conflict of interest over here. Are you the treating doctor or is the mother the treating doctor?
Yeah, we are the treating doctor, ma'am.
You are the treating doctor, correct?
Doctor,
Now,
yeah.
whenever we have a child situation, okay, we have to remember that they cannot decide for themselves. Although the patient becomes a legal surrogate, but decision which involves any sort of life withholding treatment where you have to not resuscitate or where you don't have to go aggressive. Here, the problem is there is a conflict of interest. Such cases will require institutional oversight. So, here, what the ethical committee will do now, they will ensure that whatever is in the best interest of the child should be followed. There will be a legal protection for the doctor because the mother, being a physician, should not sue the doctor that when I told you, you still did it. And there is going to be an unbiased decision making. So here they have given you this to confuse you that she's working as a physician. So of course, if first go, you will always think, oh, she's also a doctor, let's do what she's saying. But she's a mother as well. She is the relative of the patient. Do we follow their advice? No. Now, respecting her wishes cannot automatically withhold life-saving treatment. Ignore her and intubate, it will disregard parental authority. You cannot do that. Now, whenever there is adults, please remember this very important pearl. You have to respect their patient autonomy as we saw in the DNR question. Children, we have to always do what is the best interest, and standardized treatment is something that we have to give. Third point, whenever there is a situation where there is an end of life decision in children or minors, you have to follow ethics committee. Whenever there is conflict of interest, be it a child or a minor, you have to escalate it to the ethics committee. These four pearls, if you understand, you will not make mistakes in further upcoming questions. Adults always go with their autonomy. Children do what is best interest. End of life decision in minors ethical committee. Conflict of interest escalate. Now, for example, if this question, I will twist this question a little bit. Let's say that in this question, so I'm explaining you, hence I'm telling you. Now, this is a child who has multiple anomalies. Mother works as a physician. The child is extremely breathless, is unable to breathe at this point of time, and has come to you pulseless. What are you going to do? Are you going to ignore her and intubate, respect her wish, or call ethical committee? Here, the question is about emergency management. Are you understanding? They have mentioned that the child is breathless, is coming cardiac arrest. So you will resuscitate. Why?
You
Because
can't
that
wait.
is the best interest of the child. But when there
Mhm.
is a conflict of interest, you should involve the ethical committee.
Committee.
Understood? ऐसे बहुत questions
Yes.
हैं even in your question bank which can confuse you and you all will come up with those doubts. Hence, I'm making it very clear. Now let's look at this question. Mother refuses to intubate her immunocompromised child because her previous child died in the same way. So what do? Do you ignore her and intubate the child or you don't intubate the child? Now use your logic and the explanation that I have given you and then answer this question.
Ignore her and intubate the child
Okay, why do we want to do that?
because child is immunocompromised
Correct.
and
Immunocompromised, so
best
child's best interest.
Correct.
best is ignore
Correct. So this is an
intubate the child.
immunocompromised child. We
Mhm.
know that it can be reversed. Immunocompromised doesn't mean that the child will always die. Now, this patient could be having some viral pneumonia, could be having some immunosuppressed pneumonia. We do not know. That all we don't know, but we just know that it is said that it is immunocompromised child. So here we should ignore her and intubate the child. Now again, same thing, patient is a minor, can't decide. Situation is life-threatening and potentially reversible. If you intubate this child, there is a possibility that the child will survive also. So even if the parents are refusing, but it is in the best interest of the child and it's an emergency, you will go ahead and do that procedure. Patient refusal based on a past trauma or a emotional trauma is not a medical valid reason that you have to follow. The child that had died earlier could have been some other cause. You do not know. So just because one child died that way doesn't mean that you are going to consider the same for the second child. So what is important is that you have to go ahead and you have to intubate. If you will not intubate, that means you are doing a medical negligence and you will be liable for the same. So you have to make sure that you go ahead and you intubate the child.
Fine.
So this is also important slide. Emergency plus minor plus life-saving treatment, always treat first. Patient refusal can be overridden if it is endangering the child. Consent is implied in emergencies. Document thoroughly and involve hospital authorities after stabilization. Definitely, you will inform the ethical committee. But at that point of time, even if ethical committee was in this option, you would have gone with intubate first and then inform ethical committee because the child is breathless. We don't know, immunocompromised. So as a doctor, your duty is to first save the child. Have we understood?
Yes,
Yes.
ma'am.
Okay. So whenever it's a life-threatening emergency, we have to consider, with a child, we have to consider the best interest. That may not be in coordination with the patient's or parent's wish. Now look at this question. A child with spinal myotonic atrophy, SMA, has developed a respiratory muscle fatigue and needs intubation. But the family has refused it. What will you do?
Intubate the
Intubate the
child.
child, consult ethical committee, respect their wish. Read the question again, my dear.
Consult ethical committee, ma'am.
Okay, Gigi and Tejal are saying to intubate the child. You are saying consult ethical committee. Okay. Why intubate?
Respiratory muscle fatigue and need intubation. So it's an emergency case. So first we
Reversible
need
cause,
to intubate.
irreversible cause.
Reversible.
Reversible, are you sure?
Respiratory muscle and need
अरे बाबा उसके पहले का तो क्वेश्चन पढ़. Child with
child with
spinal myotonic
myotonic
atrophy. Is
atrophy.
spinal
Okay.
myotonic atrophy a reversible condition? When it has reached respiratory muscle fatigue, that means muscle fatigue has happened. It's an irreversible condition.
Irreversible.
So, do you want to
Irreversible.
intubate? If you will intubate this child, what are you doing? You are just prolonging the life of the child, no?
Yes.
So here what you have to do is you have to make sure that you are going to consult the ethical committee. Why? Because SMA is a chronic progressive life limiting disease. Once you intubate, the patient will be on long-term life support and it is not an emergency intervention. See, you have to also consider what is the quality of life that you will be providing to the child. What will be the outcome of any procedure that you do? And if it's a reversible emergency like a trauma or acute infection, then definitely you will go ahead and you will intubate the child. Like immune compromise, suddenly breathless, trauma patient, you will save them because you know those conditions can be reversed. But anything which is neurological or which is respiratory muscle involvement or which is something, a disease which is chronic and it does not have any good outcome, उसको आप treat करके क्या करोगे? You will just prolong the illness, ना? So, however, the ethics committee is going to ensure the best interest. It is going to make a decision and make a balance between beneficence and non-maleficence and legal and professional protection for the doctor so that you are not sued in the court of law. And the patient has respiratory muscle fatigue. So unilateral intubation is not appropriate and refusal is also not acceptable or sufficient. So here, see now what you all did now, you all just read this part and you all consider it as a medical emergency, right? Dr. Gigi and Dr. Tejal. It is, but it has happened because of which condition? Spinal myotonic atrophy. What kind of a disease it is? It is a progressive life-limiting disease. So it's not going to help. Now again, intubation will be only when there is a clearly reversible emergency and respecting their wishes needs a ethical review. Now, very, very important part that I want you all to remember. Again, of course, we've discussed it in the previous questions, but you all have to follow this. Any scenario which is showing us an acute reversible condition in a child, which can be a trauma, which can be an acute infection, you have to go ahead and treat even against the parents' wishes. There can also be a situation where the patient needs blood. However, the patient is a Jehovah's Witness, is refusing that, a child, the mother is refusing that, but it's an acute emergency. So you will go ahead and you will treat. Second situation, chronic or terminal pediatric illness, you have to call the ethics committee because on that, you don't want to fall in a trap. Let ethics committee decide what is the best interest of the child. When we are looking at an adult person, a grown-up person, we've already seen we have to respect their wish. Why do we respect their wish? Because patient autonomy is very, very, very important. And the adult has capacity. Okay, if the adult does not have capacity, then it's a different thing. And whenever you have any conflict or uncertainty, like the mother is a doctor or it's a chronic illness, what should you do? Always involve the ethics committee. See, if these four scenarios you understand, you will never go in picking the right answer. Trust me. This you all have to learn by heart. Take a photo of this, write it on your notepad or stick it somewhere where you always see. And trust me, there is going to be a question on either of these scenarios where it will be a trick question. But you have to be able to choose the correct answer. Have we understood so far?
Yes, ma'am.
Confusing लग रहा है क्या?
No, no, ma'am. It's totally clear.
नहीं मैम.
Okay. So again, just a takeaway, end of life or a long-term support decision in children who has a chronic disease, you will always involve the ethical committee. Now, we have a patient who was diagnosed with pulmonary TB and got treated, but now presents with a liver failure from the treatment and is admitted in the ICU. His son is angry and wants to sue the doctor. So what is your response over here? You will tell him that it can happen to anybody. You will help him to sue the doctor, or you will calm him and tell him that the case will be investigated.
Calm him and tell him the case will be investigated.
See, at least
Okay, you guys want to go with C. Why are you all choosing C? Tell me your reasoning.
Here, ma'am, the patient presents with the side effect of the TB medications. And of course, we can't just tell him like it happens to anybody and then, it's like fate. No, we can never say like that to the bystander of the patient. And help him to sue the doctor is also out of question. So we have to calm the bystander and tell him that we will investigate it because it's not 100% sure unless that everything is finalize that, okay, yes, this is the current illness is because of the side effect of the medication, ma'am.
Okay. So see, obviously we are looking at a pulmonary TB patient. Now we know AKT drugs or anti-tubercular drugs are hepatotoxic, correct? So this is a adverse effect of the medication. We know that. But the son again is not a doctor. He has come because he is saying that because of our mistake this has happened. If you are going to tell him that it can happen to anybody, that is very rude. And why would you help him sue the doctor? Rather, you have to be very compassionate. You have to be empathetic. If you're going to argue, you are going to make the matter worse for yourself. If you're not going to admit fault, then also he will think that, are purposely you're not admitting the fault. And at no given point of time, you can be defensive. We know hepatotoxicity and liver injury happens because of TB therapies. Now, if you, as a doctor, as a healthcare professional, it is your duty to be very, very calm, be professional in what you tell him, be empathetic, and be very procedural. You inform him that yes, whatever are his concerns, whatever he is worried about is valid, and the case will definitely be reviewed and it will also be investigated, and definitely we'll take appropriate steps towards it. Now, he being a non-medico may not understand, no, that what is the consequence of these medications or what can happen, but you know. So probably you can make a case report, inform him, follow those steps correctly, tell him, which will help him calm down a bit. Have we understood? So
Yeah.
again, telling him that it can happen to anybody becomes very dismissive and insensitive. That means you are being very inhuman. Suing the doctor, again, very unprofessional behavior. Just because you don't want to take the blame, you will help suing the doctor who gave the medication. Very, very wrong. Once you accept the guilt, make them calm, understand them, you don't argue, always make sure that you are using neutral statements which will help you. Like, we will review the case, the hospital and the committee will investigate. And when you are doing this, when you are explaining this to the son, you have to also remember that you document that all this has happened, because documentation is the only proof that will stay with you. So documentation is the key. Now, whenever there is any anger or legal threat, you have to remain very calm and initiate formal investigation procedures. So don't get afraid of it. Of course, it's a situation. You have to handle it very professionally and ethically, and by being very empathetic. So that's the reasoning behind it. Have we understood?
Yes.
Now, a doctor has decided to do an LSCS for a pregnant lady due to fetal distress, but the mother has refused. So, who should sign this informed consent? Husband, doctor, or the mother?
Mother, ma'am.
Mother, okay. Others? Dr. Romina says mother. What is Dr. Tejal and Dr. Gigi are also saying mother. Why not the husband or the doctor? Logic behind it.
As long as the patient has a capacity to give consent, it should always be the patient himself or herself that gives consent for any surgery, any procedure, anything, ma'am.
Okay. So, see, we understood patient autonomy is important. We understand that patient also has the capacity. She knows that there is a fetal distress. The fetus can't take this decision at this point of time because the fetus is inside the mother's womb, correct? So here, the whole sole decision lies on the mother. Pregnant woman, the mother is the patient. We are treating the mother. A patient who's an adult, whose autonomy is supreme, who's competent also. She's competent enough to give that decision. If there was a situation where this female had a road traffic accident and there was a fetal distress and she was having a GCS of 3 and she was intubated, then what would we have done in this situation? Then we would have immediately gone ahead and done the LSCS by the husband's consent, or the doctor would have taken that decision because the mother was not competent enough. However, here the mother is competent and the husband is not going to consent on behalf of a competent woman. So, and doctor can never override refusal until and unless the mother is lacking capacity or in a true emergency where there is no time. So, although the fetus is appearing to be in distress, the ultimate decision is going to come from the mother only and no one else. Now, why are the other options incorrect? Husband has no legal authority to consent if mother is competent. And doctor consent applies only when the patient lacks capacity and no surrogate is available. If in this question the husband was not around, the mother had a RTA, the mother was intubated, the fetus was in distress. So should they go ahead with the LSCS? That decision will be based on the doctor. This is same life-threatening emergency situation, non-competent patient. You have to go ahead and you have to treat. Have we followed?
Yes, ma'am.
Yeah. Now, again, a very important pearls. A mother is equivalent to the decision maker in the pregnancy. Fetal rights are not going to override any maternal autonomy. You will always document what are the risks, the mother's refusal, and the witness's signature. So, documentation is also a very important key that you have to keep in mind, and you have to make sure that it is done appropriately. You follow the standardized procedure. For LSCS, again, informed consent must always be obtained from the competent mother, even in fetal distress. Even if the fetus is distress, the mother is competent, we will follow what the mother is saying. Now, supposedly, if I just change this question a bit, or if I just put another scenario in front of you, that there is a couple who wants to undergo tubal ligation. Okay. The husband is insisting the wife for a tubal ligation. Whose consent is important? The wife, the husband, or both?
The wife, ma'am, since the procedure is going to be done on the
Right. Exactly. Absolutely. So, wife. Another situation where the mother wants to, the father wants to, the father wants the wife to undergo an MTP, but the wife doesn't want to do the same. So, can
Okay.
the husband's decision override the wife's
No,
decision?
no, ma'am, no.
No. So over here, definitely what we are going to do is we are going to follow what is the mother's decision. Now, another situation, just a situation I'm giving you. There's a couple, you found out that the husband suffering from a communicable disease. He shares with you, you are the doctor, that kindly do not share this information with my wife. But it's a communicable disease. So what should you do? Should you share that information? Should you hide that information?
You should share it, ma'am.
Correct, because it's a communicable disease, because it is putting the wife's life in danger, right? It could be anything. It could be an HIV. It could be anything. So in those situations, you have to. Any situation where there is any endangerment to the society, to the community, or if somebody is having an infectious disease like tuberculosis and is living in the community and saying, no, no, don't tell in my community. If you're going to hide that, what is going to happen? The entire community is going to end up having that infection, right? So you are going to be doing more harm than prevention. So you have to always go ahead and inform these situations. These are just scenarios that I have given you so that you get an idea how the ethical questions go in which sequence. Now, to recap, can you tell me, adult patient, what do we do?
Adult patient respect his wish.
Okay. Child with a medical emergency.
Medical emergency, child's best interest.
Okay. Child with in conflict of interest.
Ethical committee.
Correct. So you all have understood this, that these are the basic. See, this is a very conceptual thing. Now, when you know your concepts are clear now with this, you have to always make sure, like, read the question, understand it, what kind of a situation it is. Anything that can be reversed, reversible condition, you should always do the right thing. Now, if a person is coming in with a respiratory distress, it's a child probably, but it's a reversible condition. You know it. So you have to go ahead and treat it. You cannot be like, no, I'm not going to treat this condition because it's not in the best interest of the child. It's a child. So you have to take those decisions. So that is very, very, very essential to remember. Do you all have any doubts? Oh, sorry. Hold on. Huh?
Okay.
Sorry. We have more questions. My bad. Patient is worried about talking too much and taking your time. What are you going to do? You're going to politely interrupt and ask close-ended questions, or you're going to tell him that there are more patients waiting outside.
Politely interrupt and ask close-ended questions.
Absolutely. You are going to interrupt and ask them close-ended questions. Now, the patient has underwent a tonsillectomy, but it was prolonged due to bleeding. The surgery was a successful one. Next day, the patient is asking why the surgery was prolonged. So what do you do over here? Don't tell the patient about the bleeding. Ask another doctor to see him. Involve the ethical committee or tell the patient what has happened and reassure her.
D, ma'am. Tell the patient what happened and reassure her.
Okay, why are we telling the patient everything? What did we practice?
Um,
Do no harm.
Do no harm. Yes, not
Correct.
autonomy. Do no harm.
Do no harm, na? So although it was prolonged, there was bleeding, our responsibility is to tell the patient to do no harm. You are attending the OT as an intern. The surgeon was preparing you to do the surgery on the right side, but you knew from the history that the diseased kidney is the left one. So what should you do in this scenario? Will you call the senior intern? Will you tell the surgeon about your concern? Do nothing. Leave the OR and check the electronic file.
Tell the surgeon about your concern.
Yeah, why? Because you've already read the file, na? You
Yes.
know that the site is wrong. So if the site is wrong and if the surgery is performed on the wrong site, it's a medical legal case. You do not want to do that. Now, a patient is wearing inappropriate clothes and speaking in a seductive way to the doctor. So what should you do? Should you shout at her? Should you call security? Should you get a nurse who is speaking the same language or refer to another physician? This question is a little incomplete because speaking in a seductive language but a different language which the doctor is not known to. So choose the answer apart from that. Speaking
Yes.
in the same language doesn't mean that the nurse will speak in a seductive tone, okay?
Yes, get nurse who speaks same language, ma'am.
Yeah. So now you all are getting the concepts, na? The concepts are clear, na? Now little bit.
Yes.
Now we have a case of a 15-year-old who has meningitis. Lumbar puncture has to be done. From whom will we take consent? You want to take consent from parents and assent from patient? Consent only from parent? No need for consent. Consent from the patient only.
Consent from parents and assent from patient.
Yeah, because above age of 14, the patient can also give consent. This is as per the UK guidelines. So we follow that when we are looking at DHA questions. So we have to take the assent from the patient and the consent from the parent.
Okay.
Now, a couple is coming to the clinic and asking you about surrogate pregnancy. You don't know about the topic. So what are you going to tell them? Give them a follow-up appointment. Tell them the hospital doesn't provide service. Tell them it's illegal in KSA.
Give them a follow-up appointment.
Yeah, why? Because
We'll research about it and tell them in the next appointment.
this is beyond your competence. You have not read about it, but you
Yes.
cannot tell the patient that you don't know anything, na? What is there in the hospital or how it is working. So you should reschedule an appointment and ask them to come again. By then, you can prepare yourself clearly. You can learn about what you have to tell them or communicate to them, and then you can give them the correct information. These are one-liner questions. The first 10 questions were very depth, so you all have to understand that logic to be able to solve all this. Now, there is a child who has bronchial asthma and the father is a smoker. What should be your action? You should educate the father or you should give steroids to the baby.
Educate the father.
Why are we educating the father?
So that the father will be aware of it and stop smoking. If we give steroid, he will continue smoking and there is no proper
So, what are
treatment.
we doing over here? We
Protecting.
are doing what is in the best interest of the child, no? So, it is important that we have to educate the father for that.
Yes.
Now, a child has come to the emergency because of an asthma attack. When you talk to the father about not smoking in the house, he is not very interested. So, what should you do? Inform child protection or you ignore the father and focus on treating the child.
Ignore father, I don't think so, ma'am, because long term anyway, it will be harming the child. So inform child
Dr.
protect.
Tejal, Dr. Gigi, you all are there with me, right? Yeah, they are there. Okay. Dr. Romina says inform child protection. What are you all saying? You have to inform child protection because if you just ignore, of course, you're going to treat the attack, but your main goal is what? That the child should not face more problems at home, correct? So for that, you have to make sure that you are informing child protection services. Clear, girls? Are you all with me?
Yes, ma'am.
What should you do while you are examining a patient of a different gender? Ask the nurse to come or be professional. Now, again, a very stupid kind of a question where very incomplete. It's a very straightforward question. So, as
Ask
per
ma'am.
guidelines, it's always important to have a chaperone whenever you are examining any patient of an opposite gender. Always ask for a chaperone or a nurse. You should never examine a male doctor should never examine a female patient without a chaperone or a nurse. It can lead to later allegations which are not appropriate. Have we followed so far?
Yes, ma'am.
Okay. So, today we discussed a lot about on the ethics, the legalities, the emergency situations which can arise. Gynecological procedure related emergency situations ethically important. One-liner questions. Do you all have any doubts or any questions in this?
No, ma'am, all clear.
All clear? Dr. Gigi, Dr. Tejal. Okay. Just I wanted to just ask you all, uh, when did you take the subscription with us?
Ma'am, I took last month, but I renewed for one more month, ma'am, because I believe I need to do more
Oh,
studies. So I took it along with the coaching. So when I see all the questions twice, I believe it will be better, ma'am. That's why.
okay. So you will have a repeat of everything this month. Dr.
Yeah.
Tejal, I think you joined mid-month, no?
Mm, I think she'll finish next week.
Okay, yeah, because then there are many topics which I have covered, which I covered later on, no? I mean, which I covered earlier when the new batch joined.
Hey,
So I
ma'am,
will.
only your classes have been going correctly, but then other subjects, a little bit of lag is there here and there. So we
So
had,
probably that they will cover from my
yes,
and
we
my,
covered
which are my
it.
10 important topics which I teach,
Yeah,
including
everything.
toxicology, ethics, psychiatry. I will be focusing on that. So it will again be a revision because I believe psychiatry and all those topics are a little dry. So probably you all will have a revision of those questions again because I have to cover it for others who have joined new or who have skipped those initial. I think this was your also first class only, no, Dr. Romina, for ethics one because you joined, you also joined a bit later, no?
I joined. No, ma'am. This is my second class. I saw the questions in the first class already. I joined in the
Okay.
1st of May.
Yeah,
Yeah.
okay, okay. And we had taken it around second of
Uh,
first
yours
of May
was the
only we had
first
taken.
class.
Correct,
Yeah,
correct,
yours
correct.
was the
Okay,
first
no
class.
problem. We'll solve more questions as and when, but we have to go through the other lectures also for Dr. Tejal and others. So we'll be revising. If you all have any doubts, if there is any specific topic which you would want me to explain, even after the MCQs are done in each class, you can just let me know a day prior and we shall discuss those.
Thank you.
Okay, now my next class is on 5th.
Okay, ma'am. Thank you.
Okay, bye everyone. Take care. Read up.
Bye, ma'am. Thank you.